Welcome to our Wednesday call where we talk about Medicare, the Medicare madness call, if you will, where we talk about Medicare Advantage plans, prescription drug plans, hospital indemnity plans, Medicare Supplement plans, pretty much everything in the Medicare space that you could imagine. We talk about all that stuff to keep you informed about all the things that are changing in the dynamic of the industry, new laws, regulations that are coming out that impact us as agents. Right? What do we need to do for us in order to be successful and maintain a very healthy and strong business model? So today I'm going to open up with what happened and what changed as of recently and the emails that y'all have received from me in the mail or the stuff that I got in my email from the insurance carriers, from my representatives. I'm going to share some of that stuff with y'all today, so you guys can learn about that and, really understand exactly what's going on. So let's go ahead and let me pull this stuff on up. So you'll see that what we have here is we got a email from, this one was from Aetna that I happened to send over to y'all. And what this one was discussing over here is it was talking about the new rules and regulations that we have for our clients when we're in the field or just in general while selling to the clients. And it mentioned some specific things. So if you got an email from me today, you'll know exactly what I'm talking about. But if not, I'll just kind of cover it real quick. So basically the rules came out and they said, hey, starting in October, we're going to need y'all to record all conversations with your clients about plan specific information. Okay. And then they say, hey, you also got to record all sales that you do. Okay, fine. Right. And then it goes on to the next line. It says, except for face-to-face sales. I'm like, some relief. That's great. Okay. So that's phenomenal for us as agents to know and understand that as a field force, once again, we are, out there and we're not concerned because the laws and the regulation wasn't created for us. Okay. As a field force, because we're not the one that's going out there and taking advantage of clients. It was created for these call centers that just hammer the phone. It's nonstop. You guys literally, you do it. You see it when you're out in the field. If you've been out in the field during AP, you see there's 15 phone calls coming in to these poor people, and they're not even requesting the information sometimes, or maybe it's an older lead, whatever it might be. So now everything that these people are doing in the call centers has to be recorded, right? Whereas for us, we're face-to-face sales agents. So we don't need to record our face-to-face sales. So that's a tremendous thing right there. So I really want y'all to kind of understand that and how that works. And obviously, I'm not the compliance department, right? I'm the sales department. That's basically what I run and I drive. So I get the information. I just pass it all along to you guys. And what I tell every single person to do is I say, hey, get with your local rep and talk to that local rep that you have at every company and talk to them all and say, hey, how does this change impact me? Okay, so let me tell you what I did. So what I did is I went to my local reps and I emailed all of them and I said, okay, so local rep at United Healthcare, if I get a complaint, right? If an agent gets a complaint, what is going to be requested of them in terms of recordings if they do a face-to-face sale? So I say, okay, well, this is what is going to be requested of the agent. So the agent's going to need to provide any recording of the sales process. Okay. So the question would be, did you do the sale face-to-face or over the phone? Okay. I did the sale face-to-face. Problem solved. Don't need to provide any recording. That's simple. Did you have any conversations with a client about, plan specific information? Right. So if you're booking an appointment or something like that, they told me it doesn't need to be recorded, right? You're not going into detail about plan specific information. Okay, fine. Not a problem. So the answer is no. You called, you booked an appointment, you sat down with the client. Okay. And that's it. Well, then there's no recordings necessary. Okay. So we're pretty protected with that since we're face-to-face sales force. Now, if you're calling a client and the client asks you about plan specific information and you're talking to them, you're going over different things that involves a specific plan, whatever company that you enrolled them in, okay, then you are going to need to record that call. And in Sunfire, if you look at the video that I sent today, I took time to sit down with one of our representatives And if you go ahead at one of our reps at Sunfire, and I talked to him, sat down and we went over all this stuff. And if you look at the video, you watch the video, you'll see exactly what's coming out for us to be able to compliantly record all those calls. So you guys don't have to stress about it. It's a number that they give you. It's free. We pay for, it's free for you guys. We pay for it as an organization. So it's not coming out of your pocket. So when you get to that billing point, just understand that there's no cost for you. Okay. So don't worry about that. So we're covering all that cost. It's embedded in the software. It'll be out next week, or, by the 30th, you'll be able to start doing this stuff. There's also some new cool features that I made a separate video from another conversation with a Sunfire rep that I saw. I was able to go ahead and take that and put that in a separate video. So make sure you're really paying attention to that stuff too, and watch those videos. I take a lot of time to read all this stuff, learn about all of it, and educate you guys as best I can so we can stay as well informed as possible, which gives us a competitive advantage over our competition, right? So going through all this information is very, very time consuming to read this stuff, get with the right people, and make sure that I research it properly, because I can't give you the wrong information, right? That's not fair. So I got to do a lot of legwork to do this. So just please make sure you're taking time to actually look at the content that I'm sending you and watch it, right? I put it in video form so you guys can watch it while you're on the road, right? That's really the intention of it. Or you're pulled over, you can look at it and not just, some boring emails and that's it. And you got to read it and figure out for yourself. So just make sure you're doing that. All right. So if you guys have questions on that as well, just shoot me an email about it. I don't want to make this a compliance phone call. Or Zoom. That's not the intent of the call, is to be compliance, right? That's not my department. That's not what I do. I'm going to give you guys the information as it comes along to me. So what I want to do today is I want to talk about a Medicare Advantage plan versus a Medicare Supplement plan and the difference. Okay. So I found some really, really cool stuff on when I was looking at, and you can actually do this stuff when you're going through the carrier's websites. You could just pull this stuff on up, and they have a lot of information on there about the Medicare Supplement plans, about Medicare Advantage plans. They have stuff on there that you can read. So use that stuff. Take time to read it. They email you out stuff as well. So you're able to look at everything and pull it on up. We're going to see a lot of benefits that are going to be changing. So I have one email that I'm actually sending out to everyone as well, which you will all get for the plan changes with United Healthcare. And as those come along, so right now, obviously, I can't do anything with them right now because I don't have it. It's not October 1st yet. But as soon as that stuff comes out in the updates, I'll give you guys a little taste of something, is United Healthcare is going to give these clients up to $180 a year, okay, in cash that these clients can use, to spend on things. And they can use this cash, right, to buy gift cards, for example. That's one thing that they can be able to do with it. So you can't convert it, and there's going to be benefits by doing things that are considered healthy. So let me kind of share. I don't know if I could share the image as of yet, but I'll tell you guys real quick. Let me tell you, member rewards UHC. Okay. So I won't share it with you guys, but I'm going to tell you some things that they might be able to do. So members can earn up to $180 in rewards during 2023 for things such as physical activity. They can get up to $120 for the whole year, or $10 per month, right? It's enhanced from last year. Annual physical or wellness visit, it's $15. Provider, let me just share it. Y'all can see it. Provider check-in, $5. Flu shot, $5. Paperless opt-in, $5. Text messaging opt-in, $5. Health assessment, $10. Q4, right? Q4 surprise, more info coming soon, $10. House call visits, $15 to $50. Okay, so you can do that. And then, right, so all companies have similar features to each other. Okay, so another thing that we have here is through Humana. This is the Go 365 program. So here's another pitch for y'all to be selling these products and to retain the clients on the books. Okay. So here's how Medicare Advantage members on many Humana plans can earn with Go 365. So these are both programs that they have to sign up for and do. Once again, I'll provide the information as I get the information, but also always go to your local rep. How do you get in touch with them? Call the insurance company, right? And ask them, hey, I need a local representative, whoever my marketing manager is for this area. Here's the counties that I'm in, right? Please help me out. Get me in touch with the right person. They'll give you a number. They'll give you an email address, a name, whatever it is. You're also receiving emails from those people all the time. You go, as soon as you're certified and you're ready to sell, you get on their list and they start sending you out emails as well. At least the good ones do. United Healthcare and Humana do, for sure. I get a ton of emails from them. I get more emails than I send you guys. And in addition to that, I also get emails from Cigna, Aetna, WellCare. So most companies are sending me stuff, but specific reps, you'll see those as well. So right over here, what this is these are going to be actual. Let's just scroll down so you guys can see it, right? Humana Go 365 members can redeem their rewards for gift cards to retailers they know and love, with the potential to earn more than $200 in redeemable gift cards to all these places. Barnes and Nobles, I didn't know that place still existed. So all these different locations and everything that you have over here, you could go ahead and get it. So I could probably zoom in a little bit so y'all can actually see these a little bit better. Y'all should be able to see it. So we have Walmart here, Barnes and Nobles, gas. They could get gas, Macy's, Safeway, Kohl's, TJ Maxx, Marshall's Home Goods, Subway, British Petroleum, BP, gift card to Publix or Walgreens. So obviously Publix might not be in some areas or some states, but I think you guys get the drill. So how do they do this stuff, right? It's the same thing that I was just going over with the United Healthcare one. Attend a class at your Humana neighborhood center, right? Virtual or in person. They get $5. Attend an eligible health education. They get $5, right? Other classes, painting, dancing, local university, $5. Athletic event, boom, $5, other event. So it all adds up. And what they do, okay, is they send these out. You get your $25 gift card for what you're already doing, which is your annual wellness exam, mammogram, $30. Collect, okay, y'all know what that is. So you do that, a bone density, $20, diabetic. Okay, you get the point. All right. So you get money for this, and then you have to go online and register and create an account. Okay. So it tells you how to do that for agent use only. Do not distribute, FYI. So it says it on there. It tells you how to create an account. I don't know if it says it on this one or not, but it says it. It definitely says it somewhere. So you may file a complaint, office of rights, auxiliary hearing aids. Okay, this is just the basic stuff. Okay, yeah. So get with your local rep. There's a way to do it. In fact, I've sent out an email before that gives you all the instructions to do it. So search through your email for that. Okay, so that is the update for those ones real quick. And then I got a lot more stuff coming. So let's get into the benefits for Medsupp versus MAPD and kind of how those work. All right. Medicare Supplement. Let's kind of talk about a Medicare Supplement real quick. Every single Medicare Supplement is the same regardless of company. Okay. So it does not matter, no matter what the physician's mutual rep tells a client. Okay. Medicare pays first, the remaining bill for Medicare covered services. Part A, inpatient, also known as hospital. Part B, medical, also known as outpatient, right? Anything that is covered, Medicare covered services, the remaining balance is then sent to the private health insurance company, which is paid. That's all that it is. I mean, at its core, it's probably the easiest thing that y'all can understand in the entire world, right? It's nothing complex at all, to be honest with you. It's just new. And when it's new to people, it can be confusing, right? So if I was to pull up this chart here, which I will do in just a second, I'm going to show you all this. This is from the training that we have here. I'm going to swap these monitors real quick. All right. So if I go to slide 4, it should be on. All right, here we go. All right, so if I go to this slide, basically what this means is this is going to show you of all these different letters. There's only 2 that we can sell. So pay attention to this 4th column, which is G, and the last column with the 8th column, which is N. Okay, so those are the only ones that we're able to sell to new beneficiaries. Just in general, this is the only stuff that you're going to sell right now. Okay, make it easy. You can still sell these ones, obviously, as it says here. Just pay attention to the G and to the N. So G covers every single thing, part A and your part B. If you need blood, it covers the first 3 pints, check, right? Part A, hospice care. covered, check. Skilled nursing facility, covered, check. Medicare Part A deductible, covered, check. Medicare Part B deductible, not covered. How much is it? $233 this year. Next year, probably, I hope it doesn't go up as much as it did last year. It went up, I think it was like about 15%. It went up by $30. It was 203 to 233. So that's a pretty large increase, even though it dollar amount only $30, percentage wise is pretty large, especially for the senior market. Medicare Part B excess charges. The doctor can't charge them any more money than what they're billing Medicare. That's pretty cool. And foreign travel emergency. So that's pretty awesome. So as you look here, it pays everything except for this. So they go to their doctor, basically they got to pay a deductible, $233. Then after that, if they have knee surgery, they have a heart attack, they go in, they have major heart surgery, they get cancer, they need chemotherapy and radiation, right? And that's hundreds of thousands of dollars of medical bills. They don't pay a dime. There's no co-pays. There's no co-insurance. Medicare Part B co-insurance or co-payment covered, right? They don't pay it. So with the Medicare Supplement, they don't pay a dime. But what they do pay is a monthly premium payment, okay? And that's in addition to their Part B premium, which is $170.10 this year. See how much it goes up next year when I get the actual prices. So there's what's called a COLA, cost of living adjustment, COLA. And every year, that is what determines how much our Social Security beneficiaries are going to have an increase in their check. What the government likes to do is give with one hand and then simply take with the other. So they give them an 8% increase, or last year was 6%. But this year, as you can tell, cost of living adjustment due to inflation, okay, should go up pretty high. So the numbers that I read from AARP, pretty reliable source, is 8 to 10% increase in COLA. Could be less. I probably won't be more, but it could be. So since the inflation is crazy, they have to offset with these seniors for their Social Security. They got to offset that with increasing their Social Security check. So the good news is, you're sitting down with a client and their check is $2,000 a month times 10%. That's an extra $200 that they're going to get next year. Now, granted, I know the price of everything went up, but hopefully it, decreases and things stabilize. That's would be ideal. But even if it wasn't, 10% and it's 8%, that's still a nice check. So that would be $160. So that's pretty good. So every 1% of a $2,000 check is $20, right? So that would be $160. So that would be pretty cool for our clients to get that as well. So the premium that these clients pay for their Plan G, right, on this screen over here, after that premium and after they pay that $233 annual deductible, they don't pay a dime. So that's really the beauty of these plans. So if you ever hear me talk about them, I tell you that these are Cadillac plans. These are the best thing that you can get, right? For me personally, if I was enrolling in Medicare tomorrow, I'd get a Medicare supplement. I'd get a Plan G Medicare supplement with a prescription drug plan, either Silver Script or WellCare Value RX. I think that's the one that's like $12. One of those. I don't take any prescription drugs. I take a ton of supplements. So I'd get something like that. For me, that's what I would personally have for myself. Okay. At this point in time, and things change, right? 5 years ago, Medicare Advantage plan was not nearly as good as they are today. Right. So the Medicare Advantage space is increasing. And the answer is like, well, how could it be zero premium? Right? How could it not cost me anything per month, but this cost me something? Well, one, it ain't free because you paid taxes in the system your entire life. And now you're using your Part A and your Part B of Medicare. So nothing in life is free. You did pay for it. Okay. And two, the other reason is because the federal government funds this stuff and pays the private health insurance companies money to maintain the healthcare through a Medicare Advantage system. They're paying them about $1,000 per month. So when I look at it on paper, I say, hey, this Plan G is the best thing that this client can get. Now, what are the downsides of it? The downsides of a Medicare supplement is that they don't get any dental, vision, or hearing, and it doesn't include prescription drugs. So all that is sold separately, right? This is a la carte, but you get the best, right? This is the best steak that you can possibly buy. So I would recommend, if someone can afford it, to go this route, right? Especially if you foresee medical issues in the future, right? Your family has a history of heart conditions, and as long as you can maintain that premium, stick with it. The downside to this as well is that the cost of it goes up every year, right? So they have a COLA for the seniors for Social Security, but the insurance companies, they also are having an increase in costs for themselves, right? So it costs them more money to maintain the healthcare plans when people are sick. They have to pay more money out of pocket. So what we see is that they go up every single year, 2-3%. Some companies go up more. So I just had an example of a client that called me where her plan now over the years, right, is $200 more per month. And I told her this. It's like, this is what's going to happen. You're with a small shop, right? It's not a big insurance company that's be able to offset that risk, right? The larger the company, the higher the premium payments that they're getting into the pool means that they can offset the medical costs that's happening inside the pool. So when I look at it, I say, hey, you know what? For this lady, and like, good news is you're healthy, since these are medically underwritten to get into a Medicare supplement plan. And since Medicare supplement plans are identical, no matter what company you go with, it doesn't matter. They're the same thing. Look at it. Plan G is a Plan G with every single company. This is what it pays. Okay. So if we eliminated the company's name, right? If you got rid of this, from United Healthcare, it doesn't matter. And it was and just so you guys know, when you see UHICA, it stands for United Healthcare Insurance Company of America when you're filling out the application, by the way, just in case you wonder what that means. That's what it stands for. So when you sit down with a client, you see she's paying $400 a month, but she's in good health and she's with XYZ insurance company, right? And her premium's like crazy. And you're looking at the Plan G rates and you pull it up in Sunfire and you're like, there's no way, right, that I could save her $100 a month. And the reality is, more often than not, you're going to see like, wow, you really can. Because a company might have good rates today, but they might not have good rates in the future. Okay. So the larger the pool of people, the more stable the premiums will be long-term. So that's important as well. So that's the good thing for our clients, right? And that it's an easy for you to change them from one plan to another, as long as they're healthy enough and medically eligible. So with that said, we can describe kind of what a Medicare Advantage plan is, which many of y'all are already familiar with. So I don't need to go too in depth, but I think it's obviously important as well, since, I'm recording this, I'll share it with other agents and stuff. But basically, Medicare Advantage on that side, the nickname for it is a Part C plan. Okay. And the reason why people like it is because there's no premium associated with it. So that's pretty cool. So a lot of people we sit down with, they can't afford to pay $350 a month for their Part B premium, their Medicare supplement, their dental, vision, and hearing, their prescription drug plan. And then they also have to pay for the prescription drugs, right, when they go to pick them up. So that can be a lot, right? That can be a lot for seniors on a fixed income. So luckily, we have a product that we can offer, right? So whenever there's a problem, there's always a solution, right? And the bigger the problem, the bigger the commission check usually, right? Or the more amount of money people are going to make by solving that problem, right? So healthcare is a pretty big problem. So with this, you have a zero premium plan, okay? But the downside is that you have networks, okay? You got to go to a doctor and network. A Medicare supplement, there's no network. It doesn't matter. You go to any doctor in the entire country that accepts Medicare, right? Over 62 million people, right, are on Medicare. So a lot of doctors take them, right? Pretty much a majority of doctors in the country will take those plans. Probably 95%, right? They'll take those plans. So, or they'll take Medicare just in general, regardless of the health insurance plan. But with the Medicare Advantage plan, it's a network-based plan. Now, for every single person that has health insurance, they are used to a network-based plan. Only with a Medicare supplement can you just go to whoever you want. But if you have employer coverage, okay, you're going to have a PPO or an HMO if you have employer coverage. So a lot of these people are already accustomed to using network-based doctors, right? That's for them, it's like, yeah, there's really no difference between what I have right now with, let me see if Megan's on. I don't think she is. I don't know if she is. What Megan ran into today was a client that had a federal employee benefits. And they were paying $268 for the plan. It had a $6,000 maximum out of pocket for in-network. And then I think it was like 8 or 10 grand for maximum out of pocket at a network, right? So the most amount of money that they can spend in a year between co-payments, co-insurance, and their deductible. And she was paying $268 a month for it. And I just told her, I was like, you know, the daughter was there, power of attorney, and we were just talking. And I just said, it basically becomes a math problem, right? So all that it is I can get you a PPO that's going to cover all the stuff that you currently have, right? And I just take that $268 and I minus $170 per month, and I'd save you $98 a month. It's about $100. Let's multiply that by 12. So you're saving $1,176 a year, and we're going to get you something using your red, white, and blue card, your Medicare card. Okay. We're going to get you something that is zero premium, right? So if you were to have one or the other, since you don't need to have both, you were to have one or the other, I can get you a PPO that includes prescription drugs, includes all of your dental, your vision, your hearing. It gives you over the counter. Some of them give you transportation, right? Let me also tell you about all these rewards that I just went over that I was just telling you all about, right? The Go 365 from Humana, or the member rewards from United Healthcare, right? Here's all the different stuff you can do. You can earn up to $180 with United Healthcare. You can earn up to $200 with Humana, right? Why is that not part of your pitch? Would you sell Royal Neighbors without pitching Royal Neighbors and how great that company is, founded by women for women, 1895, right? They were the first insurance company to allow female policyholders. The CEO of the company always has to be a female. Why would you not pitch those amazing things about that insurance company? What about the member benefits of the company? You get a free will, right? Why would you not pitch that stuff? You have to, right? It's part of the pitch. It's part of what the insurance company does. It's the value add that they provide. So it's the same exact thing for this client. We're able to save them $1,200. It's like, it's a no-brainer. Well, you go into Medicare, you get your Part A and your Part B. You only pay a premium for your Part B. It's $170 per month. That premium is going to go up every single year. But like I asked you, you said the premium's going up every single year with what you currently have, right? And we're basically going to get you something that's identical to what you already have, if not a little bit better, right? So, and the reality was that it did come out really better, and we were able to save them $1,200 a year. That's a lot of money. So especially for seniors on a fixed income. Now their prescription drugs are, free, since they're saving $100 a month. Now they don't have to pay as much. Their budget now is going to go up. Their Social Security check is going to go up by a larger dollar amount. So the Medicare Advantage plans, with those ones, they're network-based plans, right? So you do need to know the doctors, you do need to know the prescription drugs, you do need to know any specialists that they go see, right? Their pharmacy. There's stuff that you need to know to make sure we're putting them in the right plan, okay? And they're network-based, but there's no underwriting, right? A Medicare supplement, that's got underwriting associated with it. So you need to have a plan that's underwritten, right? And a client could get declined. Well, a Medicare Advantage plan, there's no underwriting. Everyone's automatically approved. So people are like, wait, so you can currently have cancer and get in this plan? Yes. Yep. Does the insurance company, do they want to pay large amounts of medical bills? No, but the federal government's funding it. So there's no underwriting at all involved in it. Now, what do they pay? Okay. What does a client pay? Because the plan's zero premium. Like, I get that, right? They don't pay anything for the plan itself. With the Medicare Supplement, right, they pay a monthly plan premium. Okay, that's fine. How much are they paying? Well, they're paying, let's just say it's $150 a month. That's their plan premium. And then they don't pay a dime after that. Okay, that's pretty cool, right? That's pretty cool. So as far as it goes with the Medicare Advantage plan, when they go to the doctor, they pay a copayment, right? If they go into the hospital, they pay a copayment. Okay. So that's important as well. And we call that a pay-as-you-go system. If you don't go to the doctor, you don't pay. If you go to the doctor, you pay, right? And most of these plans, as you know, if you go see a primary doctor, $0 copayment. If you go to see a specialist, right, $20, $30, $40, whatever it is in your state for your area for that specific plan, right? But the dental, the vision, and the hearing is all included in it. It's one card. They don't bill Medicare. They just bill the health insurance company, right? That's it. Downside, you can only go to doctors in that network, right? And it's network-based plan. So you're limited as to where you can go unless it's an emergency. So that's good. That's important as well. And the insurance company's fighting for you because they deal with the providers themselves, right? So you don't have to worry about dealing with providers or anything like that. But that can be a downside as far as that goes, because you're going to have referrals, right? If you have an HMO, you're going to need a referral. Whereas with a PPO, you might not need a referral to do that. So those are some of the main things and the main differences that we deal with. Steve, he's over in Connecticut. So he wrote a message over here. He said no underwriting in Connecticut. So yeah, so there's some states where there's no underwriting at all for those ones. So that's absolutely correct. There's some states there's no underwriting for Medicare supplements as well. And that's definitely, specific to each state. Most states, obviously, they're going to have underwriting in there, but there's some that don't have that underwriting in there. And I have that somewhere as well that I can share with you guys too, which ones don't, but a majority of states do. So yeah, so that's some really important stuff for you guys to understand. And that's kind of your pitch between the difference of the two, right? And I always like the old saying in sales, keep it simple, stupid. I want to keep it as simple as possible, right? So if I break it down to its core and I'm talking to a client, I say, hey, there's really two different options that you have, okay? Option number one is you pay a monthly premium to United Healthcare. Should say, for example, you pay a monthly premium to United Healthcare. And then when you go to the doctor, you don't pay any co-payments. If you have a heart attack or stroke, you don't pay anything at all. You just pay your monthly premium. Now, it doesn't include prescription drugs, so we got to have another premium for that. So nothing crazy. Could be $12 a month, could be $20 a month. And if you want dental, that's another plan that we'd have to get as well. Okay. Usually the cost for all that stuff, $170, $180 a month. And you also have your Part B premium, okay, which that's $170. Pay that no matter what. The $170 has nothing to do with the health insurance company. You're paying that to the federal government. They take it out of your Social Security check. You don't even feel it. Okay. So that's about $180 a month, let's just say. Then we have another one, right? Separate from that, it's called Medicare Advantage. And what Medicare Advantage is it's zero premium. Right? It's not free. Okay. Just remember, it's not free. Pay taxes your whole entire life to use this Medicare system. So I can't get it, right, at all. I'm not eligible for it because I'm not in Medicare, right? So Medicare Advantage is a zero premium plan, and it's a pay-as-you-go system. If you go to the doctor, you pay. If you go to the hospital, you pay, right? But if you're healthy and you don't go to the doctor, you don't go to the hospital, you don't have a heart attack, right? You don't break your leg, you don't pay anything at all, right? That's the difference between the two. Okay. So Medicare Supplement, very easy. Medicare Advantage, you got to go to the doctors within the network, which I'm sure isn't a big deal for most of our clients, just simply because a lot of our clients, they're on a fixed income, they're not traveling a lot. But if you're dealing with a trucker that's, doing, interstate trucking and he's going all the way from Texas to California. Yeah. I mean, a Medicare supplement is probably the ideal thing for the guy to have. But if you go into, low income mobile home park and, they're clearly not traveling and their check is, $1,500 a month and they're not going anywhere, and HMO is not that big of a difference for them. Okay. Because they have to go to doctors within the network. Well, they can't afford the $180, one. And two, for them, they don't really care about networks because they're not leaving the area. And if they did leave, an emergency is covered. So I just keep it really, really simple with the clients. And I'm very straightforward. I want to be honest with the clients and just tell them the truth up front, right? And just be really straightforward with them, give them all the information that they need without making it too convoluted. I don't want to confuse people. Confused agents don't sell. Confused clients don't buy, right? So that's why I want to keep all this stuff really simple. You can go into the weeds with this stuff and you can dig really deep and learn as much as you want, right? That's what I did. I wanted to learn a lot of it and become very good at this stuff and very knowledgeable about it all. So that was something that was really important for me to understand and dig really deep into the stuff. So with that said, who's got some questions about any of that stuff that we have here while I try to pull up the document that I have for the states with no underwriting for Medicare supplements. If anybody has any questions. Okay. So Steve, he asked a question and he said, how do we handle leaving the summary of benefits? Okay. So this is very, very important. All of these insurance companies, they, luckily enough, okay, what they do for us, okay, is they provide us with great marketing material. Okay. And this marketing material, I absolutely love it. They're actually providing us with nice quality stuff that we can leave behind with our clients. So some of these things are going to be the summary of benefits, right? That's the thing that pretty much every agent orders, right? They order the summary of benefits. So the summary of benefits itself is really awesome because it's going to have everything about the plan in there. How much do they pay? What's their over the counter, right? Do they get a food card? All stuff like that. I think that stuff is absolutely awesome. And I love that stuff. So, and that's something that I bring in every home and I go over it with them. Right? I have booklets. I order them. I keep a ton in my trunk. Okay. So I pretty much have, because you know there's some plans that you're not going to sell at all. So don't order a booklet for those ones. Okay. Don't order a booklet for a plan that has a premium. If a plan has a premium, you're going to be doing a comparison. Medicare Advantage plan has a premium. You're going to be doing a comparison on Sunfire and showing them why, you know, hey, this plan's pretty much identical to this one, but it doesn't have a premium. You're saving $100 a month. Okay, one. And two, the summary of benefits is great to leave behind with the client because it decreases in the client's mind, hey, is this a scam, right? Because they just met you, first time talking with you, right? So leave behinds always do that. Like we talked about on, you know, our past 2 calls, 3 calls, we always talk about that. So I always leave a summary of benefits behind with the client. Always do that. Make a habit of it. It's a great habit, right? It's great marketing material. You want to leave that stuff with them so they can review it as well. Look at it. They might have questions, right? So that's stuff that you can order through all of the carrier portals. If you don't know how to do it, just you call up the company. They're going to walk you through how to do it and how to order stuff. Another great reason for having a local rep is they have offices that you can go pick the stuff up at. So I always found that to be pretty cool. And I get to sit down with them and talk with them for a couple minutes, especially right now as they go into AP, right? They are jam-packed and they'll get pallets and pallets of summary of benefits and all marketing material. And not only will they provide you with marketing material, besides the summary of benefits, they're going to give you other cool items, right? So like insurance companies, they send me stuff all the time in the mail. I get promotional items. And I'll kind of show you. Let me see let's see. I know that I have some stuff that I ordered from, let's see, from United Healthcare. Let me show you guys real quick. This isn't the summary of benefits. This is just some materials that the company allows you to order. So every year you get a different status with United Healthcare. This is just an example, and you can order stuff from the company that I found to be really, really amazing. Purpose, I don't remember which one it's under, but I think it's promotions right here. So sorry, no results. That's interesting. All right, so I'll mess around with that and I'll find it for you guys. But as far as it goes, what happens is the companies, they allow you to order a bunch of different stuff. So some companies you can actually order real shirts, you can order the pullovers, you can order the zip ups, which is amazing. So you can order actual material and your reps will give you stuff like that too, right? So they're going to give you a legal pad with United Healthcare on it. They're going to give you some leave behinds besides a summary of benefit. And I probably have stuff on my desk somewhere or in my drawers somewhere from these companies that is stuff separate from a summary of benefits that we're legally and compliantly allowed to leave behind with the clients, which I find to be amazing. So I have my gear ordered. And every year, what I was saying before, you know, I couldn't find the product itself was what I was looking at is what I ordered from United Healthcare based on your tier status that you have with them. Oh, I found it. Here we go. Based on your tier status that you have with them, whether you're silver, gold, or platinum, you get a certain credit. So platinum, $200 in credits, silver, or gold 125 and silver 75, I believe. I don't know. So you get to order these materials here. So check this out. They're going to give you, and you can pay for it yourself, right? This is $42. It's a pretty cool United Healthcare zip up that you get to wear. We're heading into wintertime, right? So that's a pretty cool thing to order and, you know, rep the brand when you're out there. I think that's pretty dang awesome. So I like that. So you can, feel free to order it from them, and the quality is going to be good, I'm sure. You can order just a regular polo if you just want a regular polo, depending on where you live, right? So you can have that. That is awesome too. So they have that color. They have the white color, different sizes you can order. They have this was the pull up. Where's the other ones that they had? There was a blue one. Maybe it's sold out. I don't know. Here's a pullover. So this one isn't the full zip up like the other one is. So you can order that too. And then they also have another one in here somewhere. I know that is maybe they're sold out of it. It was a blue polo. Maybe I bought the last ones. So I went in there, I used all my credits and I bought all this stuff. So I have literally a ton of these things coming to my house because I had a bunch of credits that, they give me. So order that gear and it makes you more official, and talk to your local rep as well about getting this stuff, because I find that to always be good. When I go into my closet, I have all these insurance companies that we sell with from the life side. I have a AmAm, Royal Neighbors, Transamerica. I have so many different insurance company brands that I wear when I go out there in the field. And that's what I like. It makes you look more official when you're going into a home that you use United Healthcare or that. And I always tell people, hey, don't let this shirt fool you. I work with this company. It's a great company. I've been working with them for X amount of years. I also work with all these other companies. Okay. And let me tell you the different ones. So I don't really care about the company. I care about you and what's best for you. In the end of the day, that's really all that matters. So we have a summary of only the plans that we offer. Yes. So Steve asked a question. He said, so we have a summary of only the plans that we offer. Yeah. So that's what Sunfire is going to provide. That's going to tell you which plans that you're going to be ordering this material for. And we'll look at that. We can do it on a case by case basis. Once you get the feel for it, you watch those videos, you'll kind of see exactly what we're talking about, and you'll understand which ones to order. Lynn said, I assume that is the new enrollment kits, the summary benefits. If you go to, and every carrier is different, however they do it. So if you go to United Healthcare, just because it's the one that I have up already, can you guys see my screen? Nope, you can't. Okay, let me pull it up and let me go to the sales and marketing department here. Let me share my screen so y'all can see it. Okay, so you go ahead and you just click order materials here, and it doesn't work most of the time, the first time. So I just click it again a second time. And then right over here, you can just go through it and you can order the materials. So whatever state you're in, let's do it for Steve. He's up in Connecticut over there. And then you would just go ahead and you would select, next you would select your county. So we'll go to Hartford, and obviously the plan year 2023. Ooh, look at that. They got it on here. Cool. Coming soon. Sorry, y'all. Coming soon. Not there yet. So we'll look at it coming soon. So that's not on there. I'll click it just for fun. So clearly not on there, but they have their system is set up now. So at least it's in there. So that's actually cool that you guys can see it on my screen now. So yeah, so 2022 obviously is what we have right now. October 1st, you can order your booklets, or whenever your rep says that you can do it. So you have a bunch of different plan types that you can choose. So you can do your special needs plans, which is great, or your MA plans or your prescription drug plans, right? Language, you can choose whatever language you want it to be in. If you're bilingual, awesome, go ahead and have both of those. And then what I do is I just scroll down to the summary benefits, right? So go ahead and I have that, and there you go. So in that area, he has a PPO DSNP. So you can do a couple things. You can just download it. So that way it's going to open up as a PDF, and you would save this to your Dropbox, your computer, and you can look at it. It's the same thing you're going to get from Sunfire. And then what you can do also is you can click it here, and you can download it. You can review it right on this page, and then you can go ahead and you can order it. So you can order as many as you want. They give you about 20 of them. It tells you the information stuff on here. You just add it to cart, which is probably on here somewhere that I'm just overlooking it. And then you would just go to my cart whenever you're done, and you would check out. So that's as simple as it is. It doesn't cost anything to order those booklets. Every company's different as to how many you can order. Don't over order. and, have too much of the stuff and then just, throw it away. But 2023, obviously you'll be using for the rest of the year, starting October. So that's awesome. Cool. All right. So who else has any other questions in here? Medicare Advantage, Medicare Supplements, change of the season. You all now see where you can order sales materials, where you can order your marketing, your nice shirts, your clothes from the insurance company to go out there and rep the companies that you work with, right? Really rep those companies and be proud of the companies you work with. You work with the best companies in the entire country, right? So that's an amazing thing. So, okay, cool. Well, I'll let everyone go. I appreciate you guys, as per usual, for joining these calls. Thank you so much for helping me make these successful. I know not everyone can be on them all the time. So I love recording these and chopping them up and putting them on YouTube, which I'll get to everyone either this evening or the next day. You get this stuff and it's free of charge. You get to plug in whenever you want and do it. So if you know people, obviously, that can't get on them every single Wednesday, I totally get it. Every single Monday at 7 p.m. Central Standard Time. Monday is our final expense training call. Every Wednesday, same thing, 7 p.m. Central Standard Time. That is our Medicare training call. I send them out on YouTube and I send it out to everyone. So you got them. So cool. Appreciate everyone. Have a wonderful evening. If you need anything, feel free to reach out to me, text me, call me, email, whatever you need to do. I'll be available. Thank you so much. Have a great night.